Good evening. Welcome to Talk Ottawa. We hear a lot about the city's aging population, but what does it mean? What challenges does it pose? And how is the city preparing to deal with the fact that over the next 20 years, the number of seniors in Ottawa is going to more than double? We're going to talk about that tonight on Talk Ottawa. Joining us for our discussion are the chair of the Advisory Council, the Advisory Committee for the city, Peter Van Boecshoten. Am I saying that right?
Peter Van Boecshoten.
Peter Van Boecshoten, Chair of the Seniors Advisory Committee, and as well City Councillor Mark Taylor, who's the Chair of the Community and Protective Services Committee at the City of Ottawa. Welcome to both of you.
Thank you.
Is that number right, that we're going to see the seniors population double over the next 20 years in Ottawa?
Exactly. You can look at statistics and forecasts of all kinds of things, business, industry, and everything else, but demographic statistics never fail unless we have a big plague or an atom bomb drops on Ottawa. You can predict exactly how many people are going to be here. And the city's done an extensive study, and yes, seniors will double in 20 years.
So what does that mean, Councillor, in terms of the challenges that we're going to face as a community as a result of that?
Well, I mean, I think, for the first time in Ottawa's history, we're going to have, more people who are senior citizens than under the age of 15. And that's going to put pressure on a lot of city services, obviously, but city services that aren't necessarily as pressured right now by the demand from that seniors demographic. But it's also going to have an effect on how we need to plan for the future, which is what our older adult plan is all about. Everything from, how we build our transit systems and our sidewalks to where we're going to see those pressures on the social service system.
Let's talk about the plan in a moment, but first, those services that you think will be impacted most as a result of these changing demographics, which services are we talking about?
Well, I think in terms of direct impact, obviously, there's going to be a lot more need for community support services, whether it's in the social services side of things, or whether it's in the public health side of things. There'll be a lot more demand for indoor parks and recreation, for active living type programs. I think one of the things too that we have to look at is not just the volume of demand, but where it's coming from. Right now we don't have a lot of seniors living in the rural areas, but that's forecasted to change dramatically. So these are areas right now where we really don't have the infrastructure to provide those services because we haven't ever needed it. We are going to need it in the future.
Can you give me an example of that? If there are more seniors living in rural areas and in the suburbs, how does the city need to respond to that? What do you need to do because of that?
Yeah. Well, at present we see what you kind of expect, which is more seniors near the core, and the further out from the core that you go, the less seniors there are. But the reality is that folks who are living in the rural areas now, or the outer urban areas, these are folks living in Stittsville, Cumberland, South Nepean, those kinds of places which are rural or getting more rural. They're going to choose to remain in their homes. The city and the province have been, worked very hard to try and ensure that we have an aging in place program so people can stay living in their homes under their own care and power as long as they can. They're going to do that. They're going to do exactly what we want them to do. But the reality is then you're going to have a groundswell of seniors in these areas.
Peter, maybe you can talk a little bit about the dynamics that are changing and what else we can expect as the population shifts towards an older population.
Well, we were talking about 20 years from now doubling, but actually it's happening now. We can see it in our senior centers that registration for seniors programs are going up. It's affecting OC Transpo now. More and more seniors are taking the bus and not driving anymore. Healthcare is certainly being impacted. Now, healthcare is not necessarily a city responsibility, but in the health prevention area, the public health, the demand there is going as well. So as the demographics move along, we're seeing that now.
Yeah, we always think of healthcare as the area that's going to be impacted most, which is not a city responsibility, but at the same time it touches the city, it affects the city, doesn't it?
Oh, absolutely. I mean, there's the two sides of healthcare, and I think the one that we often neglect when we think of healthcare, we always think of, sick folks in the hospital and the clinics. Well, there's the well care side of it as well, in order to prevent people from becoming ill and becoming that burden on the healthcare system. We have to make sure that they have access to opportunities to exercise and engage, both socially and physically in their community. So that's going to mean, programs at community centers, at recreation centers that have the capacity to handle folks, the folks who are going to want to subscribe to them.
You mentioned an older adult plan that the city is working on. Can you tell us a little bit about what that will comprise?
Sure. Well, this was actually something that was really generated by the city's Seniors Advisory Committee, and it goes back to 2008, 2009, when the advisory committee said, hey, we need to take a look at, knowing the demographic data, we have to look at, are we going to be prepared, and what do we do to get prepared? So a lot of homework's been done up to this point. The city has gone out and collected a lot of data, the very dry stuff. Now we're at the point where, as part of the mayor's election platform, he had committed to having a senior summit. And the senior summit, which will be coming up October 3rd, will really be the jumping off point for 3 months of consultations, which will allow us to capture all that qualitative stuff from everybody from the average individual right up to groups that advocate on behalf of seniors, to help us craft that plan. So when we move forward, we build something that's going to be relevant for us.
So when will we see that plan?
Well, I mean, you can go to the website right now and you can see all of the background data that's been done. I mean, the plan's really going to evolve. It's not something where we're going to, ta-da, one day we have the plan. It's going to be something that evolves over the next couple of months, and we're hoping within a year to a year and a half we have a final document, knowing that we're going to have to continually revisit and update it, but something we can take to the other city departments and to our partners and say, let's implement this.
Peter, what do you want to see in that plan? What areas need to be addressed?
Well, I think it's premature right now to try and determine what the recommendation should be. If we go back 8 or 9 years, we went through a similar exercise, but it was done only with oblique partnership with the city, and they came up with 27 recommendations. But the city didn't have ownership, so a lot of those recommendations kind of fell by the wayside. This time, the city has ownership, and we're very confident that the results will prove to be very beneficial for the seniors community. But the main areas that obviously are going to come forth are housing, transportation, and allowing seniors to have independence as they age.
Where is everybody going to live when that time comes? Do seniors have different housing requirements as they get older? Is there a dynamic there that there will be a shortage of space potentially for what they're looking for, and maybe too much space of the kind that they don't want? Is that a potential obstacle?
It's certainly one of the areas that will certainly come forward both in the summit and in the focus groups that'll be conducted this fall. And there's a wide range. On the whole, seniors want to stay in place. They want to stay in the home that they grew up in. Sometimes that's not possible for physical or other reasons or caregiving needs. There's an element that will move into retirement residences, which are on the higher side for rent, but it meets the need for those seniors. Social housing, I think at least a quarter of the social housing stock in Ottawa is dedicated to seniors. And then there's the group in between, and what do we do with them? And I think the longer we can keep them in their own homes and out of hospitals and keep them active, that's really the solution.
So how do you do that? How do you keep them out of the hospitals and keep them in their own homes?
Keeping them active by getting them out of those homes, and whether it's to go to senior centers, whether it's shopping, whether it's have coffee with neighbors, whether it's to attend a speakers program. If we can keep them active both physically, emotionally, socially, and intellectually, that promotes longer living, keeps them out of hospitals, and so on. Public health in Ottawa will have a big role to play in that they have fall prevention programs and other programs which are geared towards seniors to allow them to stay longer in their own homes. And so, Ottawa's social services department also has a role to play. And we shouldn't forget all the social support agencies which are partners with the city, the public health and the community resource centers, which are also a major player in this keeping seniors able to live in their own homes.
How different will this group of seniors be the 20 years from now than seniors today or seniors 20 years ago?
Yeah. Well, I mean, I think as in all things, there's an evolution, right? So, I mean, who are these seniors going to be? Well, they're going to be us, right? I mean, they're going to be us. So you're going to see a group of seniors who are a lot more engaged, a lot more plugged into their community, both in terms of, their ability to, use technology, their ability to, reach out for service and know where to go to get service, that kind of thing, because they'll have grown up in an age when, they had to go out and get this stuff. So there'll be a bit of a shift for sure, and that actually works in our favor because it'll help us to be able to connect with them and keep connected to them a lot more than ever before. But as Peter mentioned, I mean, that those network of partners, the community health centers, the community resource centers, they're going to be integral in ensuring that they're the ones on the street corners. They're the ones who have the daily contact. So for the city to make sure that we have the proper programs being run out of these facilities, that allows people, enables people to age in place, stay in their homes, stay in their communities.
One of the questions that people ask, I know there are many aspects of this that cross into provincial and federal territory as well, many aspects of the challenges that we'll face as a society, but people ask, how will there be enough people who are working to support through tax dollars the people who aren't working? Is that a dynamic that affects the city as well?
Yeah, I mean, sure it is, of course. And I mean, you're right, there's got to be a point at which the city says, kind of here's the end of our responsibility. But we work with the province and, we're in communication, of course, with the federal government about, what the needs are of this municipality and what it's going to look like in the future. You also do see a lot of seniors, though, some by need, many by choice, who are choosing to work longer. And that's another way of keeping engaged, with their community. So while on the one hand, yes, you're right, there is going to be that retirement wave that's going to come, and ensuring that we have an adequate taxpayer base to fund all of this is a concern. At the same time, we have the blessing that a lot of these folks, they do not consider themselves and will not consider themselves, at retirement age.
Right. Does the retirement age need to change, do you think, Peter?
I don't think it really does, and you're going to have people working to age 80 sometimes, and you'll still have some people retiring at 50, 55. But I think one thing we have to remember is that there's a huge untapped capability here with seniors as volunteers. They can do a lot of things as a volunteer that might free up employment that would otherwise be required, whether it's for the city or elsewhere. I think statistics have shown that 60% of seniors volunteer in some capacity or another, and also it's a two-way street. The younger seniors can volunteer for the older seniors, and have a focus and an aim. It's like going to work, but they're accomplishing something, and the other seniors benefit from that expertise.
So there, you're talking about an opportunity, not a challenge.
Exactly.
You're saying that this group of retired seniors, this larger group of retired seniors, could actually be put to work in our community as a way of getting some things done.
We do that now to some extent at various senior centers, whether it's a senior be running a photo club or an exercise program or a speakers program and so on. So we're doing that now, and I think we can probably do more of that as we move into the future.
You mentioned where people are going to be living. How much pressure is that going to put on the city to provide programs in places where you're not providing them now, whether it's having a library or a community center, a senior center, something like that?
Yeah, well, for sure it's going to create pressure, but that's the whole purpose of doing this plan now and this research now, so that we don't have to, in a panic, provide capacity. We know what something's going to look like out in Osgood in 20 years, so we can start laying the groundwork now for when do we need to build a resource center out in Osgood that for that emerging need. So it's going to put pressure, but at the same time, remember that there are going to be other areas where we've got an aging demographic. At the same time, of course, we'll need to continue to support the needs of our youth. We're going to see a little bit of ease up on the pressure from that side. So it's about the shifting of resources.